Hello, this is Dr. Steele. Today's questions ask if I can analyze and clarify what the A1C is all about. Remember, the A1C is a test that we do it every 3 to 4 months. And the reason for that is because we are actually measuring the sugar content inside that it gets attached to a subunit of the hemoglobin inside the red blood cells. So the hemoglobin A1C, we test it every 3 to 4 months. Roughly 120 days, that's how long the span of the red blood cell lasts, how long it lives. So every time all of us eat our food, as I mentioned yesterday, the food needs to go from your mouth to your esophagus to your stomach and then to your small intestine, and all the way down is being broken down to little pieces, and then it gets absorbed inside your gut. It goes through your vessels. Through there, it gets distributed across the body to nurture other cells. And of course, on inside those vessels, you also have red blood cells that have been produced by the bone marrow. And like I said, like I just mentioned, every 120 days, they're being recycled. So just think with me for a minute. If a red blood cell is floating around the plasma, your blood, what happens if the sugar is too high in that plasma, in that blood? Well, slowly but surely, that red blood cell is going to be saturated with sugar. So the way I can explain it to our patients is that red blood cell is like a donut. It's going to be glazed. So if a lot of molecules of glucose or sugar is attaching itself to it, it's going to give us a percentage of how much sugar is attaching itself to it. So it gives us a guide of how much sugars in your bloodstream are for the last 3 or 4 months. And as I mentioned on my other stream or video, is that if the sugar is high, I can just explain it to you that sugar high is like honey. So honey is sticky. You and I know the plasma or water is not sticky. So slowly but surely, it's going to start sticking around your vessels, and the space around your vessels is going to be reduced. And if it gets reduced through time, and I'm talking about weeks, months, years, and decades of having high sugars, then we run the risk of having the end organ damage. Those vessels get blocked. There's no more blood flowing to those organs. And then we have what you already know and what we're trying to always prevent, your heart attacks, your strokes, your amputations. Unfortunately, the vessels in your eyes or your kidneys or your nerves can also get affected. So it's important for us. That's why I mentioned on my other videos to control. And we are always so obsessed to control, as you know, your sugar levels, which is called your diabetes, your cholesterol, and your hypertension. We're always also looking to control also your vitamin D deficiency, because I think that's very important for metabolic control. We're also always attempting to control if there's a need for testosterone replacement for males. And we're also checking for thyroid dysfunction, because it seems to be fairly common with patients with diabetes. But this happens not because only diabetes, it's because all of us are getting older. So remember this, and I tell my patients all the time, that people think that diet and exercise is the only solution sometimes to our problems. But I have explained before that even though I exercise, even though I eat right and drink water and take my vitamins, my gray hair is not going to go back to normal. So what does that mean? I'm losing that ink of that hair, that those melanocytes are not producing enough of that color anymore. So as we get older, it's not personal. We may need more than just diet and exercise to supplement what our internal body is not producing anymore. And I mentioned to you that we have here in our practice the mindset of how to take care of your diabetes by explaining things into little bites, which I'm doing that right now, of information for you to have something what I call the POM, the peace of mind framework to take care of your diabetes. So remember I said that you have PDC, it's not police department, but it's PVDC, P for prevention. We are always obsessed with preventing complications. And we're also very uniquely in tune to detecting problems before they come up by doing testing and checking, of course, blood parameters and so on and so forth. And we're also very also keen on taking care of or controlling those factors that should be modified for us to have less complications. And again, just reiterate the point. We are attempting to delay complications that have to do with the main problem with diabetes, that the food that we ingested, not only the sugar, not only also the proteins and the cholesterol, all that stuff is not being picked up right away from your circulation, and your vessels get damaged. And if they get damaged, they get obstructed, and then we have those complications. So again, I feel that if you're going to go to your doctor, you need to find someone like me to explain things to you, because diabetes is not only a medication. The solution is not only just giving medications to patients, is to start making them aware of how to think about diabetes, how to approach it, and how to find solutions for it. But the solution is not going to be just the magic pill. There's always going to be more information and more tools that we need to implement for us to achieve that control. Anyways, that's my message this morning. Again, if you like this content, let me know, like it. And if you have questions, I'll be happy to answer them in the near future. For now, make it a fantastic day. Have a blessed day.